Okay. Yeah, so we just want to hear your services here, how many patients you are seeing, and what else we can do to help you. Yeah.
Okay. Usually we don't have a specific number because it depends. Yes.
But on average, how many women are you delivering? How many women are giving birth? Let's say in a week, in a month, on average.
On average, again, we have more than 20 people.
More than 20.
Daily average is usually 20.
About
20. Yes.
Okay. And how many midwives do you have here?
Just for
It's not confident. You know yourself.
We have 25 midwives.
25 midwives.
Yes. I think this is down. Please.
Oh, the substantive.
Yes.
Oh, okay. How is it?
that.
Okay, yeah. I know, I was just asking how many deliveries you do, like on a daily basis on average, or even a week?
On average, on a daily basis, about 22.
22.
Then in a week, 150.
150 a week. So that's about what, 600 per month?
Yes.
Okay, all right. And how many midwives do you have?
In the delivery, we have 16 midwives. In the antenatal one, there are 4.
4. So you have 20 midwives.
Postnatal, we have 1.
1, 20, 21.
Yes.
How many are you supposed to have a year?
At least about 25 to 30.
25 to 30. So you are better off there. Yeah, it's not bad, eh? If you have 21 years old of 6, so you only need about what, 9 to make a full complement?
Yes.
And what about the general nurses? How many do you have?
The general nurses, there are 7.
7. Okay. All right. So what are the major challenges here in terms of your services, the way you're operating?
Okay, number 1 is the staffing. And then we have also challenge with equipment. I think so far we only have 1 CTG machine. And then even the oxygen concentrators, we have 1. And the suction machine, we only have 1. So if we use it on the babies, then it means for adults, we have nothing. Yeah.
Okay. So have you submitted the needs assessment of the equipment for the facility?
Yes, we have.
You have. Okay. And with the coming of the new facility, in terms of bed space and all that, what do you expect?
So the new facility will assist us here in that there we have a postnatal ward, or better termed a post-surgery ward. Yes, so it has 7 post-operative beds, which we've earmarked to house women after cesarean sections or gynecological operations. That's where we'll be keeping them.
Okay.
Yes.
All right. Any other thing to say? Or are you looking forward to going to the new building?
Yes, we're looking forward to going to the new building, though we need staffing there as well.
Yeah, staffing. Dr. Makope is there. So, because the bigger the facility, the more the staffing, and the more the equipment, isn't it?
Yes.
I hope the equipment has also been delivered because we'll quickly inspect the new facility.
Yes.
The equipment is in place.
The equipment is in place and staff have been trained, just waiting for the go-ahead.
Yeah. So let's look at the staffing needs for these facilities that will be opened. Because we don't want to open a big facility and then we have no staff, Otherwise it will not make sense. So the infrastructure should be there, the human resources should be there, the equipment should be in place, and of course, the medicines and medical supplies, everything should be in place. How many ambulances do you have here at Chawama?
So we have 1 ambulance for the COVID response, and we have our general ambulance. Yes, so in total we have 2.
Are you managing COVID patients here or you are referring them?
We refer them.
Where?
We stabilize and refer, depending on their oxygen saturations, to Levy for those below 60% and to UTH for those above.
Yeah, I think with the coming of the new facilities and looking at the huge numbers, what is your catchment population for Chawama?
So Chawama, 430,000.
That's a huge one. That's almost 500,000. Yeah. So that is close to the population, probably which big city in Zambia? I don't know what the population of Ndola or Livingstone is.
That's sitting close to Chingola.
Close to Chingola. Yeah. So you have Chingola district.
Yeah.
So Chingola district having the same population probably like Chawama alone.
Yes.
So that's why I was saying these very populated places have to be treated like districts, not like townships. Once you treat it as a township, then you lose the site. So how do we manage a district? That should be the model that we should have a district kind of approach. Because ideally, they should actually be districts, looking at the population, right? Yeah, so you can have one city of Lusaka, but the population themselves, right? dictate that this area should be districts, and that is why in future with government, we appreciate the huge infrastructure coming up, but there will still be much more need to invest in all levels of care in a population where you have 500,000. Because you can imagine by 2030, you can have 1 million in your catchment, very easily. You may double the population in the next few years. So we have to be futuristic. Yeah, okay. So thank you so much, sister. We'll look at the other places, but we thought we started with a very important one. Thank you. Yeah. Thank you so much.
Introduce our public health specialist.
Oh, okay. Oh, how are you doing?
All right, so we can go to pharmacy next. Honorable sir, this is our in charge for the pharmacy department. This is Goma Mwangata.
Okay, how are you, madam?
She's joined us recently and very resourceful. Very happy with her.
Okay.
Please, you can introduce your team.
Yeah.
So these are third-year students from Evelyn Horn as well as Eden University. So they have come on industrial attachment. They joined us this week, starting yesterday. So I'm just orienting them and making them acquainted with the situation here. Yes.
Okay. So in terms of your drug storage, how well stocked are you?
We are quite well stocked, only limping with a few commodities.
Where are you limping?
We are living with antibiotics. Yes, though we have some in stock that we are managing
Okay.
our clients with, our patients with.
How often is medical stores or ZAMSA now? How often is ZAMSA supplying you?
We placed an emergency order last week, so we are expecting it to be processed this week.
Okay, but do they supply you regularly, like monthly, or how often do they supply you?
Beginning this year, we have received once.
Once, and this is almost March. Yeah. Then what about NEMA? Is NEMA patients being catered for? Are you getting any resources from the National Health Insurance?
Yes.
Are you purchasing any medicines, medical supplies from NEMA?
Yes. Yes. So we've just nearly completed our second CAP under NEMA. And those funds, primarily we use them to procure essential commodities earmarked for NEMA patients.
Like which ones? Which essential commodities?
So things like IV fluids, analgesics such as paracetamol, antibiotics, the syrups mostly, amoxicillin, things like that.
So in terms of proportion, between NEMA and ZAMSA, where are you getting most of your stocks?
We've gotten most of our stocks recently from NEMA.
NEMA.
Yes.
All right. Okay. Well, thank you so much. Yeah. And what challenges? What are the challenges that you are facing here? Where can I help you?
I think the challenges we are facing mostly are with the surgicals. We are running out mostly with the gloves as well as the cannula. Yes, those are the areas where we are limping mostly.
No, well, the Director Clinical and Diagnostic Services, Dr. Makupe, is here. So I'm sure he's taking note. Yeah. Yeah, no, just to reassure you of our support. Yeah, that's why I came to have a first-hand look and see also how we quickly commissioned this new building. Yeah, but we're going to support you. Thank you so much. Yeah, thank you so much.
So, what's the OPD? So our OPD is to the right. So just go this way.
You have inpatient what?
Yes, we do. I have a quick
Yeah.
All right, we can go this way. All right. Go this way, sir. So the new
Yeah.
yes.
I know.
Yeah. And so the new building is really a blessing for us because this infrastructure has been a legacy of the clinic, so to say. And as our population has, please, this is a bit long. Oh. But yes.
We're talking from experience.
Yes. So as the population has grown, we have outgrown this OPD.
Oh yeah.
Yes. So this is our OPD. This is our central waiting area. We have registry to the left. As they get ready for the we have a tent outside with a screen for temperature, the COVID response. So now they line up to get registered. We're using smart care. So after having their vitals checked at the gate, they line up here and the details are captured at our registry at this point.
I see a lot of patients not wearing face masks.
It's something we're trying to enforce at the gate.
Cross infection, you know, someone who comes with something.
So this is that's where the initial triage takes place.
Where?
This blue tent we're seeing.
Or the tent?
Yes.
Okay.
The building to our right is the maternal and child health department.
Yeah.
Okay, so this now is truly the starting point.
Okay.
Yes.
Morning.
So main gate, please. I'm sure you know our honorable minister, Chanda. Please introduce yourself. You can briefly tell us what you're doing here.
Just 1 minute, under 1 minute. You are in a tent. I'm wondering when it rains how you survive.
Okay, from here is where we talk.
Just speak up.
We get the vitals, because when we do temperature and the treatment is like. Yes, we also speak for COVID temperature.
Okay. Yeah. But make sure you're a bit distance. Then you shouldn't be too crowded.
Yes, so they're making a queue from that side, and then that's when they come one here.
Oh, even yourselves. Yeah. Okay. So I think you're looking forward to a new building, because in terms of space, it's about space. The population is big.
Yes.
Yeah, and we hope that very soon you can have the new building commissioned. Yeah, so you can do your work in a better condition.
Yeah.
That's why I've come. Yeah. All right. No, thank you so much, sister. Thank you. All right. Thank you.
Yeah.
Yeah, so I don't know when they'll do that. They'll probably operationalize the hospital as soon as possible.
So here we're similar to the center for Chileje. Yes. So down here we have our reception and physiotherapy, chest clinic.
So maybe we can have a quick just two one.
Someone is just bringing the keys.
I mean, this is the same like what we have. Yeah. This is a tape, yeah? Or what is this?
Physiotherapy.
It's a huge one, yeah?
Yes, it is.
What are the keys?
She's coming.
Yeah, you have a lot of books, I think.
Yes. Even the wellness.
Basically, gym. Very good.
The wellness component for our health workers to be also seen by the physiotherapist.
While we wait for the keys, I think let's do a quick one, yeah? Yeah.
Okay.
And here is chest clinic.
Okay.
Yes.
So,
And then
tell me what else is
the operating theatre block.
Let's see.
The operating theatre block and the post-surgery ward.
The contractor is not around.
They've handed over the keys because we have completed our... Yes, in fact, the hospital administrator is just bringing them.
So everything else is up.
Everything else is up. So the first floor we have waiting area. Waiting area and the screening cubicles as well as dental, X-ray. So I hope he's the one bringing the key. So what is supposed to be? This is the screening area, waiting hall and screening area.
You know what?
You're on the wrong. Bring the wrong keys.
Bring the countries for you. So this is what?
So this is IMCI, so the pediatric screening area.
Okay.
Yes. Dental.
So these are the registry, X-ray, ultrasound.
Yes.
And the dental services.
Dental.
Let's go to the other one.
So what we haven't
I think we're clean.
One. Because I don't want to compare to the, so we have to go down.
Yes.
Compared to the one we're coming from at Kanyama.
Yes.
Kanyama has what?
Yes. Here all we've gotten is the 7 post-operative beds.
Why have you
You know, I was
why haven't they got what compared to the other one that is coming?
The challenges are the same.
It was, I'm told there was a dispute with the community when at the planning phase. Land. The area that was earmarked for this place was where we are coming from, the maternity ward, that whole area. But the community would not give it up. And so they ended up allocating JICA this small portion. And that's how we didn't get it.
Once in a lifetime,
Yes.
testing, eh?
The area relocated the post office.
Yes.
Or they used to be a source of a
Yes, so actually allow this to take place.
Otherwise, we were almost losing it. He was the first one that came to Chilenji.
Yeah.
But we
So
lost
where
it.
can we do the wrap up? You can stand here. The provincial So from the area MP's office, do you have anyone from the parliamentary office?
No.
You don't have. So the one standing or you are the councillor? Yeah, Doc, we'll start with you, then the director himself, right? The councillor, you also don't talk like a politician, talk like a councillor. No, let's start with the councillor.
Okay.
Yeah.
I'm happy that the Honorable Minister, you found time to visit us here and see this facility that has been constructed for the people of Chawama. Chawama being centrally located in Lusaka, I think we are happy that we've got this facility. There's nothing much to say, but just want to appreciate and thank the people And the government, want to thank the government for bringing us this facility. You know, it gives joy being born here, and then you are seeing buildings like this being actualized, becoming a hospital, and it was just merely a clinic, and this has just come here. We appreciate that.
No.
Thank you so much.
Thanks so much, Councillor. Maybe you come to the in charge, the medical superintendent.
Okay. Yes, thank you, sir. So we're very privileged to receive you today, and we're grateful for the leadership of the ministry, our provincial health director, for all the work that has been done to make this facility a reality. You have toured the old building, and really we are anxious to utilize the new facilities. And for us, all we can say is we'll safeguard the equipment, we'll safeguard the infrastructure, and we are really looking forward to utilizing the new facility for the benefit of the people. Thank you very much.
Thank you so much, Dr. Chanda.
Yes, maybe just to add on to what my colleague has said for the hospital. On behalf of the Provincial Health Office, we are really honored that Lusaka province was selected to house 5 general hospitals at one time. So for us, it's a huge lift in the way we're going to manage health services in the province. And as you know, for a long time we've been depending on UTH, and then secondly, Levy came on board, but now we have all these infrastructure that are going to provide services across the country as possible. So really grateful that Minister of Health, through the government of the Republic of Zambia, His Excellency, the President, we are honored as a province, and we're really grateful.
Yeah.
Honorable Minister, thank you very much for the opportunity. The coming of this infrastructure comes with improved quality of care for our patients in Chawama, and we are very excited as a department. Honorable Minister, we are just going to strengthen them. Through human resource, we are going to ensure that the teams at UTHs, the consultants, and the registrars in training pass through this as a rotation. And if we do that, that will debulk the number of patients that we are seeing in the outpatients at OP. It's possible an orthopedic surgeon can conduct a clinic here, Honorable Minister. It's possible a gynecologist can conduct a clinic here. It's possible a pediatrician and a physician can do the same, and that will entail that we congest the UTHs. That's the way we are going to do things, Honorable Minister. Thank you.
No, thank you so much, Doc, and your team, for coming us this morning. And thank you, Dr. Tambatamba, the provincial team, for welcoming us. We've looked at the 2 facilities, basically Kanyama and then Chawama. Yeah, these are hospitals. Yeah, firstly, I just want to thank His Excellency. You know, the President used to be Member of Parliament for Chawama. And I know when PF came to power in 2011, the infrastructure was, very minimal. It's the old one that you see. I've been here also as a student. In 1997, I used to come to Chawama Clinic. You know, it was a very, very small clinic. But to see now the level of infrastructure, I mean, who thought we could have this level of infrastructure? Yeah, no one. So I think we thank the President for having prioritized the putting up of this huge infrastructure here. But like I said, what we need now is to operationalize. Yes. We need to commission. Madam Councillor, welcome. Yeah. So what we need is to operationalize, because once you open up these facilities, then the patients can have access. Like you rightly said, Chawama has a huge catchment population. You know, we are talking about close to 500,000 people in catchment. So we know that while this is a huge improvement, there will still be need to do more. Yeah, like we said, the uniqueness about Lusaka is the huge population in the townships. You look at Chawama, you look at Kanyama, you look at Mandevu itself constituency, Bowling and all these huge populations. So the model of care, our district, our director clinical and diagnostic services. So the model of care for Lusaka, I think we need to treat these townships more like districts. Yeah. So if you treat them like districts, then we're going to have quality of care. If we continue treating them like townships, then we're going to collapse the quality of care. Like we said, if you look at the population in Chawama alone, the catchment is much bigger than many towns in Zambia, much bigger than many big districts. So let's have a district kind of model for care, so that we can actually lobby for more infrastructure. These older ones will have to go at some point, so that we put up these huge infrastructures here at all levels of care, starting from the smallest up to the highest. So I think let them be treated as districts, fully fledged districts, in terms of the quality of services. And even staffing and equipment should follow the same way. We need district level services here. We need district level kind of health workers as well. Yeah. So thank you so much. We look forward to making sure that this place is, finalized and all that. So, Madam Councillor. Yeah. Yeah, welcome.
Thank you,
Yeah.
Minister.
Thanks for coming us. We've just done a very quick tour, just to appreciate the old infrastructure and also the new infrastructure, and just to give you assurance that we as the Minister of Health want this place to be operationalized soon, so that the people of Chawama can get the services that they deserve. As you know, the population is so huge here. I've looked at Chipata first level, Kanyama, and then this one here in Chawama. And as a medical student, I used to come in 1997. So we had a very, very small clinic here, So to see this huge infrastructure, it's very, very good. So you can just give your remarks and what else you want us to help you as Minister of Health, so that we quickly open this space. Yeah.
Thank you so much, Honorable Minister, for coming. We are really impressed that the infrastructure has gone up as quickly as possible, and we look forward to you opening it as quickly as possible, so that we can deliver those services to the people.
And for Chawama generally, how many clinics do we have apart from this big hospital?